Hey everybody, this is Darin Francis with Harbinger Lane, and this is the Signals in Higher Education podcast. Today with me, I have Geoffrey Roche, who is the Senior VP of Healthcare Strategy at Risepoint. Geoffrey, thanks for coming on.
Thanks, Darin, for having me.
Yeah, absolutely. Excited about this conversation. Healthcare is kind of at the center of the economy these days. It's the metric we watch in terms of so much of the health of the employment sector. It's a lot of things, and so I love that we can jump into this. Also, we're coming at this conversation from a perspective of a higher ed audience who's thinking with us about experiential learning. And I've always said that, next to maybe teacher preparation, healthcare and teacher preparation are sort of the long-standing traditions of experiential learning in education. We just had Kim Eckert from Craft Education talking about teacher prep. And so it's great to have you talking to us about the healthcare space in general. So I want to actually start the conversation where I always do, which is more on the personal journey side of things. To me, people that are in the world of education, if they're effective and doing well, it tends to be because there's a real passion. There's a real intersection of their passion and their career that took place. And so I know a little bit about your journey, but I wanted you to help us sort of flesh it out. But if I look at your background, your career's been at the intersection of healthcare, education, and workforce development. Take us back to the beginning. What drew you into this space?
It's interesting, Darin. I mean, in many cases, what actually drew me in was certainly the influence of my mother. My mother, is a registered nurse. She earned her associate degree when I was age 5. I have vivid memories of that, experience because my mother was a single mother. And I remember, my mother was also an immigrant, to the United States from Germany. And so my mother and her parents and her brother came in 1963. So she was the first in her family to actually obtain a community college or even a post-secondary degree. And just the sheer joy and excitement that my grandmother and certainly my grandfather had of that accomplishment. And then also being able to do it as a single mother, even more so. And so that was certainly a big influence because obviously throughout my childhood, my mother would talk about all the work she was doing, in nursing, in healthcare. I never thought actually I would work in healthcare. And in many ways, the reason for that is actually I was, very involved politically at a young age. At age 12 was very active, on election day, throughout campaigning, helping campaign for various local offices, and then ended up doing state and federal. And I actually, when I was in high school, started to work for a local state senator while I was, student part-time after school. And many of my, classmates would say, this is interesting, we're going to have fun and you're going to work. But, for me, it was always more about that professional side, the customer service side, the engagement side. And then when I was a senior in college, I had worked for a local state senator part-time through high school and then college. Then in college, ended up helping a local state rep win a special election, and then ultimately worked in his office part-time while I was the student in college. And then as a senior, as a junior, I did a Capitol Hill internship. And after that experience, I thought I'm going to go to the Hill. There's no question. I just loved, that environment. But I quickly learned that, what you make on the Hill coming out of college is nothing. And, with someone that would have student loans, that would be problematic at the time. And so my advisor said to me, well, why don't you go do an internship for the final semester of your senior year at a hospital? There's a lot similar that you'll learn. I could get you an internship in their public affairs, government affairs space, and let's just see if you find interest. And so I did that at a local hospital at the time. And then ultimately I had a great experience. And a month after I graduated, I ended up applying and landing my first job in a hospital. And it's the same exact hospital my mother had worked at as a nurse. She was no longer practicing there at the time. She had moved on. But when I was a child, it was the first one she landed her career at. And so in some ways, I feel like that was, kind of totally, was designed to be that case. And, obviously I entered a role that wasn't clinical. I was the community relations coordinator. I was managing all of our public relations, all of our work in the community. I was also, supporting all of our strategy from a healthcare system standpoint. But there was a lot of things that I was working on actually in some cases that my mother started. And so as a nurse leader. And so I had great experience, and that's really the influence and impact.
I wasn't anticipating asking you about this, but how does somebody in high school get energized enough by government, public policy? Like, was there a catalyzing event that said, I'm going to go, sign up and volunteer in some particular way?
It was a combination. So, obviously, as I shared, my family immigrated from Germany, and the reason they immigrated from Germany is they wanted to not raise my mom and my uncle in Germany post the Nazi era, and also at a time when there was still a lot of uncertainty, a lot of frankly influence of then the Soviet Union. And so, they made a conscious decision. Other relatives that came over to the U.S. Prior, and then were able to sponsor ultimately my grandfather and my grandmother, and then my mom and my uncle to come. And as a young child, my grandmother would regularly talk about her experience growing up in Nazi Germany, and particularly what that was like, and particularly in a country where no one had a voice. You were just expected to follow a regime that obviously didn't care about people in many cases, but obviously would use a populist agenda to try and attract people to their mission, their cause, which ultimately we all know how inhumane that frankly was. And so she very much mentored and coached us around how important it was to never have that be the case in the United States. And should we ever face a time like that, continue to be an advocate, a voice for those that are truly being oppressed. And so, and then frankly, I always call this individual, my mother. I always call her, was my friend's mother, but she was like not a second mom to me because my mom is amazing, but a very important mother-like figure in my life who was also very politically involved. And when I became good friends with her son, she obviously had met my grandmother, and they had great conversations, and she was already very involved, and so she kind of just brought me along into those opportunities with her. And that obviously had a profound, impact and influence of what, ultimately led to a lot of work in that space.
Well, thank you for sharing. I think uh, it's always it's always important to me that the to see the intersection between the personal and the um, professional. And I think any more in healthy ways, we do well when we can actually bring the personal into the profession, right?
100%.
When it's not a binary, hey, I'm taking off my father hat and putting on my corporate hat, or I'm taking off my, politically active hat in order to put on my healthcare hat.
Yeah.
Um, love hearing that perspective. Um, so let's, I think that the policy and the healthcare piece being so formative is going to serve us well later in the conversation, because we're going to talk more about the work that you're doing in greater detail on the healthcare strategy side at Risepoint. But I want to level set for some listeners who maybe know the name Risepoint. Maybe they know Risepoint primarily as an OPM in the graduate program space. How would you describe what Risepoint has become, particularly in healthcare?
Yeah. In many ways, we are very, very much a learning and workforce solutions company. Obviously, to your point, many people will, know our work, particularly, that we do to help our colleges and university partners transform ultimately the delivery model of that education, and really do it in a very scalable, effective model. But particularly as it relates to the healthcare space, there's so much more that we're doing. Particularly, we have, 17 nursing pre-licensure programs that we actively are engaged in and support. And what I mean by that is, we actually have a dedicated nursing team that are all, clinical education leaders that have either been at the dean level and also have been industry leaders where they worked in leadership roles in the healthcare space as clinical nurse leaders. We are engaged in all aspects of the curriculum. We're engaged in really, engaged with chief nursing officers and other leaders across the country, listening, learning of their needs, and then ultimately looking at how do we solve that at scale because of a large number of academic partners that we have. In addition to the 17 pre-licensure partners, we also have, roughly uh, almost 150 post-licensure programs that we also support. And so that's everything from RN to BSN to masters to DNP to nurse practitioner. And then there's obviously other healthcare programs, social work, clinical mental health counseling, some allied health, some imaging, that we also have some level of support. We also, in the healthcare space, do a lot of work around clinical placements. And so helping both our academic partner and the healthcare employer, hospital and healthcare system to identify the opportunities to train our future clinical professionals. And so there's a lot of work associated with that. And then, frankly, we also do a ton of work around really the state board of nursing and the regulatory environment, because ultimately, um, all healthcare programs, if they're licensed, most people don't realize there's a lot more involved. And so we have a team that also supports all of that too. So it's really more why I describe it as learning and workforce, because we're really looking to align everything that we do to the need of a hospital and healthcare system or a life science company or a global med tech company in this space. And also, I'll just say, while I don't focus on the business programs, obviously, all these employers also have those needs. Well, we have all that in our portfolio too. And so we can really, really be an end to end learning solutions, both sponsor, provider, and ultimately help them to drive the outcomes that are expected.
That's powerful. I mean, I, I'm a little struck by Risepoint achieving so much in such a short period of time. I know that not to get into like all the details, right? But this was Risepoint was, I think, acquired back in 2019, and it was academic partnerships at the time. So sometime between 2019 and now, Risepoint decided to expand its offerings, right? So is it naive to say that the healthcare component is almost like a startup sitting inside of a much larger organization? Or has it been sort of percolating and building over a much longer period of time? And I just don't have visibility into that.
Yeah. In many ways, it's been percolating over, a period of time, because ultimately, if you go back in, legacy history, academic partnerships actually did support at the more RN to BSN and graduate level nursing programs. The pre-licensure side actually came into the fold from the acquisition of Synergist Education, but ultimately, the work we're doing today is unique and different, even when you consider that context. And a lot of that honestly comes from our CEO, Fernando, and our chief academic and product officer, who I have the privilege to report to, Dia Ranieri, really have this very strong focus and commitment that everything that we do has to be career connected. And ultimately, if we're going to make a difference for our academic partner, it's going to be in that space. And so in the healthcare space, we know and recognize that there's very few industries that actually have to have ultimate career connectedness in the same way that healthcare has. So if you take nursing, or if you take any clinically licensed space, one of the reasons why we've had to increase our residency programs, when a student is onboarding at a hospital or another clinical environment, is because frankly, on the academic side, we haven't necessarily prepared them at the same level that we once were preparing them. And that's led to some transition to practice challenges that ultimately means the employer has to invest millions upon millions every year to support that onboarding of that nurse. Well, that can be fixed, and it can easily be fixed. And there's great examples. And so, part of our work is to, not just find those examples and then scale them, but also create them where we can. It's one of the reasons why we're fortunate in this work to certainly have, an incredible team that also takes a very clinician first approach. It's not necessarily a startup. Certainly, I came in June, and so I have, certainly a lot of elements around this that I have thought very differently. I will say our team in this space has tripled in my time here. And so, the work was definitely happening. I think exponentially, it's only happening even more so now. And the other thing I'll just add is we take a very holistic ecosystem workforce development approach to this too. And one of the reasons I have a team member that has done this work successfully with other colleges and employers on the team that's just focused on, hey, how do you upskill at an employer? How do you provide career pathways at an employer? And how do you leverage the funding that's available from the federal government or state governments or philanthropy? It's one of the reasons why I believe in that end-to-end learning and workforce solutions so much is just based on the experience I've had on the employer end.
Yeah. Well, I want to jump a little more into sort of what you've built here. But when we spoke before, one of the things that stood out to me was really, and you started hinting at this earlier, but you sit at the intersection of policy, clinical practice, and academia. And Risepoint wants to see everything from a career connected perspective. Taking those three areas together, how do you think about career connected healthcare, what that means?
Yeah. So, I'll say in my time, particularly at Siemens, where I had the privilege of leading workforce development for both US and Canada, and then engaging at a global level with my colleagues on the education and workforce solution space. I had the privilege of traveling across the globe and seeing various examples at hospitals and colleges that certainly opened my eyes to really where the U.S. higher education system needs to go. And you were alluding to earlier, that you had a conversation recently with Kraft, and obviously there's many others that are in this space. I firmly believe that in healthcare, ironically, at times sort of we come back and we have different iterations of things that we've done before. But if you sit down and think about it, at one time we had more hospital-based diploma programs. In many ways, they were like a nursing apprenticeship. The idea was that a nurse an individual that wanted to become a nurse would actually be educated and trained in a hospital environment in a diploma program to ultimately become a registered nurse. Well, as time went on, obviously colleges felt that they needed to do that work. And so, it became harder for hospitals to do it. And so ultimately it shifted more to the higher education space. And frankly, at the time, hospitals, also had their challenges continuing to run those programs. There are still some that exist in the country. With that said, in my experience at Siemens, I firmly believe that the space we need in the healthcare space to move at a more scalable and sustainable manner is apprenticeship degrees. I believe every clinical license area needs to be an apprenticeship degree. I think you have to have options because not every student wants to be an apprentice. And so you run your traditional model, and then you run your apprenticeship embedded degree at the employer, and you do dual credential of the faculty, and you run the program successfully and impactfully. And, having seen this in the UK, having, seen this in the United States at healthcare systems that are doing it, it is absolutely the model that I believe is frankly the only way to also retain and grow our own, because it provides great pathways from, skilled allied health roles into other clinically licensed areas, and also retention improves. And I'll add, it also addresses the faculty shortage that we have in dramatic fashion right now in higher education. So that's definitely one. I also think in so many ways, we have also created some of the bottlenecks ourselves when we talk about clinical license programs. And so, a good example is actually in clinical placements. I mean, everywhere you go, you're going to hear clinical placements is a crisis. We're challenged. But ultimately, we have to ask ourselves how many clinical programs, especially in nursing, actually are doing it on nights and weekends. Not many. Most do it during the day because that's when they find the preceptors, 9 to 5. Well, when you think about healthcare, it's a 24/7 operation. And frankly, I don't necessarily want to have every student nurse or every student respiratory therapist or every student imaging technologist training during the day, because 9 times out of 10, it's evenings and weekends when you have the harder cases. And being trained in a harder case is going to produce a much stronger future healthcare professional. And when you talk to the chief nursing executives of some of the largest systems in this country, most of the time they'll tell you the partners in the academic side don't want to do the evenings and weekends. And my experience, it's okay, I get it. It's not easy to find people that want to teach at that time, but figure it out because there are ways to do it. And if you partner with the employer and find creative ways to do dual appointments, if you envision a different model, it's possible. And there are some that are certainly doing it.
I I uh I was aware of the apprenticeship model. I didn't realize that you guys were a big part of scaling that. That's exciting.
Yeah, I mean, we are certainly we are bullish on it. Let me say, I mean, at this time we are still actively engaged, talking with our academic partners. We do not currently have an academic partner that's actually fully, taken the next step associated with that. I have been very involved, particularly with the work of the National Center of the Apprenticeship degree out of Reach University, as a healthcare thought leader in that space. Certainly, I was actually, one of the first at the time I was at Siemens, but I was one of the first global leaders that really chimed into that cause and have continued to support and engage it. I'll say too, our chief academic and product officer has also led apprenticeship degree development in the UK very successfully. She also strongly believes that this is a space we need to move. I think there, like a lot of cases in higher ed, there's a lot of fear and anxiety around the accreditation side, whether it's the regulatory side. But that's where I say to my higher ed colleagues, let industry lead the way. Let them take on those challenges and have you come along in the supportive, critical role that you play. It's different when industry leads the way. And so we need to, be much more bold in that space for sure.
I mean, uh, what that brings to mind for me is healthcare is one of those fast moving points of innovation, change, and makes me think that there's like a real need for employer feedback loops into the education process. Feels like the apprenticeship model is a great way to be a part of that. But how does real-time employer intelligence get translated back into the curriculum or program design from your vantage point? Obviously, you guys are going to be leading a lot of that.
Yeah, so we do it in a number of ways, right? I mean, ultimately, for our partners in this space, we are doing this every day. So we have a team that's actually going out, meeting with healthcare employers, learning of their needs, learning of their challenges, and then we're bringing that back to our academic partners. At the same time, our nursing clinical education team is also doing the same thing, but then they're working with the deans and working with the faculty to envision, what are some of those bigger topics of the future. So a good example is, AI obviously is getting a lot of interesting discussion, but the reality of it is that we're not today effectively preparing our clinicians for the future of AI as it relates to their critical roles in our higher education setting in many cases. And so that's an example where we get that feedback from an employer, then we're envisioning how do we bring that into the curriculum? What changes do we need to make, et cetera, with the partner, because obviously it's their curriculum. We're just a supporter and contributor. Also, we're doing the same thing on the academic services side, since we do a lot of the work to help prepare the faculty, do the work associated with the online education experience for both the faculty and the student. And so we kind of have that loop across the board. One of the critical roles is that our nursing and clinical education team are also there in that sort of player coach model. They've been in those shoes of those deans, they've been in those shoes of those faculty, and they've been in those shoes on industry. And so they're helping them to envision how it is possible. And at times they're respectfully encouraging, challenging, empowering, inspiring to envision a different reality. And so we're doing it in a multitude of different ways. And then the other thing I'll just say is, we, everything that we do, obviously our partnership management team that works with all of our partners, we share everything with them too, because obviously there's so many different partners. There's unique variation in regions, rural, suburban, urban. Sometimes we're hearing things that are more suburban, more rural, some urban, but we're always trying to make sure we quantify that, in the discussion as well.
I would imagine you've got significantly different challenges, say in a rural uh, uh, hospital. Um, Talk a little bit about the opportunity for you guys to really make an impact in that context.
Yeah, I mean, rural medicine, certainly has some unique aspects of challenge. It's also been a space I've been extremely passionate about because I, started my career in a rural community healthcare system that obviously, had a very important role in that community because we were a sole community provider, which means at that time, for many years, for 101 years to be exact, we were the only hospital that offered extensive services. So things like psychiatric care, neonatal care, behavioral health, for example. I was also a National Rural Health Fellow. And so, I've had the amazing opportunity to study rural medicine on the ground in various rural communities and understand the uniqueness associated with it. What I'll say is, we've got many academic partners that we support in the nursing space, in the post licensure, pre licensure, and then also many other programmatic elements that are in rural areas. And so, you know, it is incredibly unique. As you know, the federal government has allocated a significant amount of money to a national to state rural health modernization transformation opportunity. That is definitely a space we're actively engaged in and looking at how do you leverage that ecosystem from our academic partners to the healthcare systems to the workforce boards, et cetera. We also, know that in rural areas, recruitment is so much harder. So it's harder on the hospital side, but it's also harder on the college side. And so we're actively engaged with our partners at times to help them also recruit faculty, to recruit clinical coordinators, because ultimately, if we don't have them on the faculty side, we're never going to get them on the employer side. And so there's a lot of work associated with that. And then on the employer side, rural has the unique challenges of having very high agency travel nursing costs because it's hard to really sustain many of their workforces by their own college supply or university supply. That's an unsurmountable and an unsustainable way to manage all of those aspects because the cost just becomes so high. And so, we're very engaged, in talking with those types of healthcare systems on, different models to consider. And, there are there's great synergies, particularly because in some cases, while a local college or institution may not be able to meet those needs, maybe we can collaborate with another institution that's in our portfolio that doesn't cause issues for the other one. So, really taking that more collaborative, shared approach, to these matters is super critical.
No, that's really insightful. I've noticed in the last, I don't know, 3 months or so of doing basically weekly podcasts on experiential learning broadly, that in the higher ed space, um, the innovators are from the regional public university, often covering a large rural population, or it's the institutions that have the the local student population who have to be plugged into the local economy. They're they're traveling a very short distance to come to school, and they're probably going to travel a very short distance from there to their employer. It's exciting to see that. I mean, there are between 500 and 600 regional public universities across the US. It serves, last count, somewhere in the 5 million student range. And a big chunk of those are going to be first gen and adult learners. And I would think a big chunk of that is healthcare related. So I have to believe that if I'm at Risepoint, I'm thinking I understand why your area is getting a lot of growth, that you're seeing the demand, you're just sort of there to meet the demand. Let's talk about it from the standpoint of, say, a nursing dean or even a provost of one of these institutions who's listening and wondering about whether a partnership model like one that Risepoint would provide is right for their institution. When it comes to thinking about an academic partner in healthcare, what should they understand about how you work, how you think, that would allow them just to start to have, just to open the door to the conversation?
Yeah, I think, you know, a lot of that starts truly with our values. I mean, we are, a type of organization that strongly believes in reaching, and we view reaching from the vantage point of, um, we know these are also challenging times, but when we come together and collaborate, there's so much more that we can actually reach in terms of our full potential. We also obviously believe in the power of empowerment, and so when I look at the aspect of academic institutions, having been at two myself, on the cabinet, the president at two different institutions, one a small liberal arts and the second a regional STEM university. I have had that experience in many cases of exactly the type of challenges that our type of partners face. And, when I look at what we as a company do in this space and as an organization is we come alongside. We are truly a team that's comprised of individuals that have walked in very similar shoes. I'll never say the same because no one can ever say that, but we walked in similar. We also, are the type of company, like I said, right? I mean, having a clinical and nursing education team is a huge differentiation on how we approach this. For deans and for provosts, that means that, there's definitely not only the expertise, but that also means there's a different way to help them do what ultimately is one of the most challenging jobs in an institution. When you're a dean of a nursing program, there's just so much that you're expected, that you're accountable for. And when you have an additional team that can support you, that's also what allows you to get to some of the innovation, frankly, because it allows you to have additional levels of support. I'll also add that, in many cases, it also provides that element of additional support around strategy, and at the same time, that immense focus on career connected learning. And when I look at our pre-licensure partners, when I look at our post-licensure partners, just in the nursing space alone, there's so much that they get the benefit of from our team. They regularly are reaching out with some smaller, some larger challenges that we're able to troubleshoot and address, very, very quickly because of having really that subject matter expertise in that specific area. And so I would look at it in many ways as, I'll say this: look, a lot of academic institutions at times will go to, management consulting firms for some of this type of stuff, and the reality, of it is that we are actually practitioners in this work. We've been there, we've done it. When I talk to deans and provosts, one of the things I highlight is that, not just having been on a president's cabinet, I know how challenging it can be when you get to budget time, and frankly, how expensive clinical education programs are. But I also have been privileged to have launched some of the most impactful clinical education programs with anchored financial support from healthcare systems like UPMC and Penn State Health and WellSpan Health in Pennsylvania. And so I have, and that's just an example of what some of the things I will talk about. But the team that I have the privilege of supporting has so much more, examples where they've been able to do that too. And so I truly know and believe that, our partners really get that really all hands on approach in this space when they're collaborating with us, and that partnership piece, we all talk about it, but I can't highlight enough how much we really treasure that relationship, because again, for me and people in my team and our organization hear me say this all the time. For me, it's all about the learner at the end. And frankly, the learner, which obviously is the learner of that academic institution, is our future nurse or our future clinician. And so everything we do has to be focused on that, because when we do that well, we address the career connected piece through experiential learning, through hands-on learning. And so that's the piece that keeps us very focused and driven too.
Well said. I think I'm kind of underscoring and thinking about uh, the point that you're making as you describe all the work that you're doing. You guys are in more of that practitioner role, and I get the tendency and the desire by universities to lean on management consulting firms and get that right from that perspective. But you make a really strong point that really it's that practitioner driven work that allows you to stay right there on the front end. You're getting that real time uh, evidence based feedback all the time from the actual hospital systems. It's a great it's a really great model. Um, I'm wondering broadly, kind of outside of healthcare, from your perspective. I mean, obviously, Risepoint's made a huge investment in healthcare, but a lot of what you're learning and what you're scaling has got to have an impact in other areas, right?
Yep.
You kind of hinted at it, but like what would be an example or two of
Yeah.
some of the things you think would be powerful learnings or things that might have already been done as a result of kind of the work your team has been doing?
Yeah, I think for sure, and again, our leadership team has really structured things very beautifully because, one of my direct peers that serves on the same team as I do is actually is Adam Fine, who came from the University of North Texas, and Adam is our senior vice president of really the career connected side of everything outside of healthcare. And so Adam and I, very much are connected at the hip in this work. Everything that we do, we share. Everything that he does, we share. And so, for example, last week I was in Dallas, where Adam also resides, and we were doing a bunch of healthcare visits to healthcare leaders across the Dallas region. And while we were there, Adam and I also went to Southwest Airlines to just have some discussions there. And ultimately, I have really no skin in the game other than the fact that I knew one of the learning leaders, and so. Um, my interest in that was to connect Adam into it, but also my interest also was a little multifaceted because what I do know is that Southwest has one of the best cultures. And so when I look at some of those learnings too, I'm also cognizant of what can I learn in that space because the airline industry, there's a lot to learn from the healthcare industry, from the airline industry. They do much better when it comes to actually taking care of their people. They have timeouts. Healthcare, we don't have timeouts. They have so many different, aspects like that are so beneficial. And so, we're always looking at that from an experiential factor. The other piece I'll just say is, much of Adam's work is very much with our academic institutions, whereas, parts of my team do a lot of work with academic institutions. Also, I'm very outward facing. Adam's both outward, but also very inward. And so, what I mean by that is he's working with majority of our academic institutions on thinking about how you do career connected learning from the academic side. And then he's feeding that to me to envision how you do that, at least in healthcare, to then on the employer side and bring it back in. So we're kind of approaching this through the full continuum. And so to your point, 100%, it's totally aligned. And I'll also say, to our point earlier, apprenticeship degrees are very applicable in a lot of those other areas too. And so, I think that's another example, whether you call it apprenticeship degree, career connected, a stackable learning experience, whatever you want to call it. At the end of the day, there's definitely total synergy. I always tell Adam I have the best industry. Obviously, he likes all the industries he has the privilege of working with. But I always tell him every community needs eds and meds. And he's like, I hear you, but I said, no, we all need eds and meds. And so we have our fun in that space, but it's totally connected.
I love the vision of that kind of partnership, and it does speak well to the culture you guys have created uh, at Risepoint. Um, Look, we've been talking for a little bit. I love where this conversation's gone. I guess I want to hit on a final theme with you. It's an unfair question, knowing how fast things are moving today, but but you've set some really high goals. You guys have got a lot of momentum. Look ahead 5 years. What do you hope to be true? What do you hope the outcomes are producing 5 years from now, given the significant investment and time and strategy you guys are putting into this?
Yeah. I definitely hope to see a lot more apprenticeship degree activity, particularly in that embedded fashion between an academic institution and a healthcare system. I just know in my heart that the learning, the upskilling, the retention, the overall experience for the learner and our future clinician is so much greater in those models. And so that is certainly a key element. I would love to see it in various different environments, to have, have it in rural, have it in suburban, have it in urban, because it does present a cool opportunity to really study and understand what that level of impact can mean across all those different spaces. I also, you know, definitely want to make, we collectively want to make a mark in the clinical placement space, because, that space has been wrestled with for a very long time. There's been a lot of tech type of companies that have come out with various solutions, but at the heart of this is people. And so you can't always just think tech fixes everything. You have to also fix the people side of it too. And so I want to make sure that in the spaces that we are in, we're doing everything we can to ultimately make that a better process for both the learner, the employer, and our academic partner, because that will have a dramatic effect and a dramatic impact. Because ultimately, it's not just about the placement; it's also about that transition to practice that I highlighted earlier. And if we are doing right, we're reducing the expenditure from the employer on that onboarding. And ultimately, we're making it not just better for that future clinician, but ultimately for the patients that they serve. And so there's the downside effect of all that as well. And then the third thing I'll just say is, I have always believed in healthcare that, it's not that it's a bad thing, but I don't think it's necessarily also the best situation where you have, colleges and universities doing all the work at the degree space. And then you have these amazing training providers doing space in other elements. There's got to be a better way to bring it all together. And I think, Workforce Pell may have some elements of that. I'll argue there's going to have to be a lot more work associated with those elements too. But that to me is super critical, because when we talk about K through 12 and actually attracting people into healthcare careers, those opportunities become profound. And that becomes the first point to actually build on that apprenticeship degree that I was speaking about earlier. And then the final thing I'll just say is, and this is obviously a topic that I continue to have a lot of dialogue on, even just more recently with the Assistant Deputy Secretary at the Department of Labor, is, there's a lot of accreditation overreach in the healthcare space. There's a lot of regulatory overreach in the healthcare space at times by state boards, by national boards. And in my experience, what I have found respectfully is there's a lot of amazing people at those organizations. And they are simply, in many ways, trying to protect the profession. But I always will say, you can still protect the profession, but also allow us to innovate and transform around where we sit today and where we need to be tomorrow. There are ways to do both. And so I also certainly want to continue to lean in respectfully and obviously engage clinician to clinician. So I, never engage on that with another clinician if I don't have a clinician with me on the team. But I want to ensure we make an impact there too, because not just for our academic partners, but also for our future healthcare professionals. If there's one thing that I personally get upset with is when I hear the stories that a regulation from 1990 or 80 from the 80s is still holding back innovation. I mean, we're in 2026 and we need to make the necessary changes that still keep safety profound, quality profound, but ultimately allow us to move the career connected work, the experiential work forward.
Well, Geoffrey, I really appreciate you taking the time today to kind of unpack this a little bit with us. I think that we could probably dive into 6 or 7 of these areas and have, an entire retreat dedicated to these topics. But really loved learning about the kind of things that you're able to do at Risepoint, um, keeping your mission central to the work, and just appreciate you out there doing it. Thanks for taking the time today.
Absolutely. Thank you so much too.